From time to time, it may become necessary for a physician to take a leave of absence from their medical practice. It could be due to an illness, maternity leave, military leave, going back for more training, or simply taking an extended vacation. But regardless of the reason why, it's important for you to plan ahead and make the necessary arrangements with your practice for your time away. So, what should you do with your malpractice insurance while you're gone? Today, we're going to talk about how to take a leave of absence and handle your malpractice insurance appropriately so that you can have peace of mind while you're away. Welcome to Malpractice Insights, the show dedicated to helping healthcare professionals understand medical malpractice insurance and providing you with the solutions you need so that you can get back to the work of practicing good medicine. My name is Jennifer Wiggins, CEO of Aegis Malpractice Solutions, and I'm so glad you've joined us today. If you're new to our channel, welcome. We're so glad you're here. We release a new episode every week, both on YouTube and your favorite podcast streaming platform, so be sure to like and subscribe to stay connected. Just a quick reminder though, before we jump in, we are here to provide general information on medical malpractice insurance and related topics, but not specific legal or insurance advice. So if you have a question about your practice or individual coverage needs, be sure to ask your agent or legal advisor, or contact us at aegismalpractice.com. That's AEGIS malpractice.com. We'd be happy to help. If you need to step away from your practice for a period of time, there are generally 4 ways that you can adjust your malpractice insurance while you are gone. Those are suspension, cancellation, locum tenens, and part-time adjustments. Let's start with the option of suspending your coverage. When it comes to a leave of absence, most malpractice insurance carriers have options for you to suspend coverage temporarily when you will be gone due to health concerns, maternity leave, military leave, and any number of other reasons. Suspensions are usually offered when the anticipated leave is greater than 3 months but less than 1 year. Leave of absence requests do have to be approved by the insurance carrier, so make sure that you plan ahead and request the suspension well in advance of your departure, as much as possible. If you plan on being gone for longer than the year, the insurance carrier will likely not grant you a suspension and you will have to consider some other options. If you will be gone from your practice for more than a year, or if your return date is just unknown, it might be better for you to simply cancel your coverage and then reapply later. If you have an occurrence policy, this is easy to accomplish since there are no concerns with tail insurance. But if you have a claims-made policy, you will need to work with your agent to discuss the possible options for securing tail insurance before you leave. Remember that tail insurance is usually 1.5 to 2 times your annual premium, depending on how long you've carried the coverage. Check out our full episode on occurrence versus claims-made coverage and our episode on tail insurance to get a refresher on these topics. We'll put a link here on the screen and also drop them in the show notes for you to check out after today's show. If you will be gone for a shorter period of time, you can have a qualified physician fill in for you while you are away. A locum tenens physician is a placeholder or one who temporarily works in place of the regular physician when they are absent. Often, a physician's medical malpractice insurance policy affords them a set number of free locum coverage days per year. This means that a locum's physician can be endorsed onto their policy at no charge, and that locum's provider would be covered in the event that a claim occurred resulting from services rendered while they were working for the insured physician. Most insurance companies will require underwriting approval before they allow a locum's physician to be endorsed onto your policy. So check with your agent to find out the best way to proceed with coverage options for any locums providers that you want to work for you. If suspension, cancellation, or locum tenens are not ideal solutions for you, you can keep your malpractice insurance policy active while you are away, but drop coverage down to the minimal hours to reduce your cost. This option will require carrier approval, but it is an easier way to maintain ongoing coverage at a more affordable rate. Some providers like this option because it allows them to return to work on occasion, whereas a suspension or a cancellation does not. There are many options for providers to consider when they are preparing for a leave of absence from their medical practice. If you are a physician, talk to your malpractice insurance agent well in advance of requesting the leave of absence so that you can know what your options are and plan accordingly. If you are a practice administrator, talk to your agent to understand how each leave of absence request is handled so that your employee handbook aligns with the requirements and the rules of your specific malpractice insurance carrier. If you have any questions on this topic or want to make sure that you're covered appropriately, click the link in the description box below where you can connect with us via phone, email, or chat today. And if you're listening, please visit us online at aegismalpractice.com. That's AEGIS, malpractice.com. We have some great episodes lined up for you in the next few weeks. I hope you found this one helpful. If so, could you do me a favor and give us a like and leave a review? And be sure to subscribe to our show so that you can watch our next installment of Malpractice Insights, where we're dedicated to helping you understand medical malpractice insurance and providing you with the solutions you need so that you can get back to the work of practicing good medicine. This is Jennifer Wiggins. Thanks for joining us.